COVID-19 cases in St. Louis, Missouri continue to rise, especially in the African American community, where, like New York and New Orleans, the black community is being impacted disproportionately.
Joining us tonight is the Director of Health for the City of St. Louis, Dr. Fredrick Echols. Thanks so much for joining us, Dr. Echols.
My pleasure.
Is there a sign that the city is nearing its peak?
So we continue to evaluate the data daily. And what the data shows us thus far is that we are slowing the spread of COVID-19 in our jurisdiction. We have our community members as well as our visitors have been adhering to our stay-at-home order, as well as implementing social distancing or physical distancing recommendations and those other simple preventive measures that we recommend each and every day.
And Doctor, of course, you have a complicated geographical area there. You got the city and you've got the county. What is the state doing to help both jurisdictions to stop the spread?
So the state has been very instrumental in giving us resources such as testing supplies, as well as PPE through the State Emergency Management Agency. And so we've been utilizing those resources in an equitable fashion, making sure that the communities that need them most receive them.
So we're also hearing about the concerns about the health disparities that exist there. What exactly can be done better in St. Louis?
So the most important thing is to understand that the health inequities and disparities that exist within our communities existed prior to COVID-19. And so our approach to addressing them is making sure that we use this opportunity to create the foundation that we need to really help our community mobilize and move towards self-sufficiency. And it's really important that we understand the root causes of the health inequities that exist. Otherwise, we'll continue to place Band-Aids on these systemic issues, and we'll be in the same position a few years from now.
And Dr. Echols, I'm a little concerned about your thoughts as far as Missouri is concerned, Missouri being one of the last states to kind of shut things down and to try to contain the virus. Has that hindered your operations at all?
It has not. So as the Director of Health for the City of St. Louis, I have a special authority under public health emergencies. And so we utilized the data early on. We started our planning in January. So we knew when the time was right to actually implement our stay-at-home order, even though the state had opted to do otherwise.
So what would you like to see happen next, and what message do you have for citizens?
For citizens, it's really important for them to understand the recommendations that the public health agencies and local government authorities are issuing. In order to do that, government agencies have to inform and educate the community, not just issue ordinances or orders, but really bring the community along with them by explaining the details of why certain measures are necessary.
All right, Dr. Fredrick Echols in St. Louis, thank you so much for your time and for joining us. Please come back anytime you like.
Thank you.